Today I will talk about the ANC profile. What is ANC profile? That is antenatal care profile. These are the number of blood tests that are done during the pregnancy, and most commonly this ANC profile is done at the first visit when the pregnant woman visits doctor, or at the time of the viability scan or the dating scan, which is done at around 8 weeks. So what are the tests that are included in the antenatal profile? These first among these is the blood grouping and typing of the pregnant woman. So the commonest blood groups are the positive blood group. But in case the pregnant woman is having a negative blood group, so immediately we will know. So for that reason, we should do the blood grouping and typing at the first visit or at the dating scan time. And if the pregnant woman is having a negative blood group, then immediately we check her husband's blood group also. If the husband's blood group is also negative, then there is no issue. But if the husband's blood group is positive and the pregnant woman is negative, then we need to do some extra tests and we need to be taking some extra care, because Rh negative pregnancies will have some different complications and different issues. So that is about the blood grouping and typing. After the blood grouping and typing, the next most important test is the complete blood picture with platelet count. The complete blood picture will give us the hemoglobin concentration, red cell indices, and the platelet count, the WBC count. This is very important, especially the hemoglobin count, because anemia, that is decrease in the hemoglobin content, is very prevalent. Almost 80% of our women have suffer from anemia. So complete blood picture is done to know about her hemoglobin status, and if she is found to be anemic, we need to treat it aggressively. Next blood test that is done is to the blood sugar levels. And Dipsy Society of India recommends the 75 grams oral glucose tolerance test to be done for all pregnant women. This is a screening test. So screening test, it is a single step, simple, and avoids multiple pricks to the patient, and the patient need not come in fasting. This is done because the prevalence of diabetes is very high in our Indian society, and especially during pregnancy also. So we recommend universal screening for diabetes in pregnancy, and the test that is done is 75 grams oral glucose tolerance test, and the blood sugars levels are calculated 2 hours after the oral glucose tolerance intake. The next test that is done is the renal function test, which commonly we do the serum creatinine. Next, we have the thyroid profile. Even the thyroid disorders are also very common in pregnancy, and we need to screen the pregnant woman for thyroid diseases. The most common thyroid diseases that we see is the hypothyroidism, but even hyperthyroidism is prevalent. So we screen it, and the patient is treated accordingly, because the maternal thyroid levels are very important, and they can affect the baby's growth. Next screening done is for the common infections, especially the sexually transmitted infections, and these tests include the VDRL test for syphilis, then the screening for HIV, then screening for HPSAG and anti-HCV vaccines. The other tests that are done is hemoglobin electrophoresis. So our ICMR recommends that all pregnant women should be screened for even the thalassemia, or to know the presence of abnormal hemoglobins, and we should screen especially the thalassemia trait, we call it, when the mother is having abnormal hemoglobin. Is she a carrier? What is the risk of the offspring getting the disease? So hemoglobin electrophoresis is a special blood test done to detect abnormal hemoglobins in the mother. Now coming to the urine test also is done, and especially we need to screen the pregnant woman for urinary infection, and the test we do is the complete urine examination and urine for culture sensitivity. This urine for culture sensitivity is done to detect asymptomatic bacteriuria, and this is should be treated promptly. We should do the test, and if at all the culture is positive, the woman should be treated promptly, because 30% of asymptomatic bacteria can lead to significant and severe kidney infections like pyelonephritis. Then the last one that is done genetic screening, and this especially in the first trimester, the screening is combined with the NT scan, which is done between 12 week to 13 weeks 6 days. In the NT scan nowadays, it is a very important scan which we should not miss, because major anomalies can be detected, and also the screening for the major genetic problems or aneuploidies can be detected by this combining the NT scan with the biochemical markers, which is done in the form of a double marker test. And this double marker test and the NT combined are able to diagnose if the patient is at risk for the major aneuploidies like trisomy 21, 18 and 13. So these are the main tests that are done in the antenatal profile, and there might be other tests which the woman may require, but the tests that are mentioned now are done universally for all pregnant women. Thank you.